Are you someone that has scoliosis and also has back pain, neck pain, or other pain you think is associated with the scoliosis, and you want to get rid of that pain? You're in the right place. Today I'm going to share with you the top three things that I feel like would help to reduce back, neck, and other pains associated with scoliosis. So I'm glad you're here. My name is Dave Butler. I'm a physical therapist at Align Therapy, and I've been specializing in scoliosis treatment over the last 12 years. And I have some good things for you. A couple of those things you can do immediately to reduce your back, neck, or other pains associated with your spine curve. And one other thing is more of a long-term solution. So let's talk about that. Make sure you stick around for that last one because that's important. That's the one that will keep it from coming back. So let's get into the specific things that you can do to reduce your back, neck, and other pains related to scoliosis. So the first one is that posture is a huge part of scoliosis treatment. When I see patients in the clinic, I observe their posture when they're initially in the clinic because it's such an important piece of the puzzle in how we reduce their pain with scoliosis. So you might be thinking that, oh, posture is exhausting to focus on, or I've tried to work on posture and it hasn't helped, or my posture is just bad and I can't do anything about it. Posture is a really important piece of this puzzle. So the more forward your posture is, the more forward your head and your shoulders go, the more strain is put on the back and on your neck, and even on all the way down to the low back and the hips. So make sure that you are addressing your posture first. Look in the mirror, have a mirror at your side, see what your posture is actually like, and then make some adjustments. Initially, it might be fatiguing, it might be somewhat sore in the muscles because your body isn't used to being in that position. Have someone give you feedback on your posture. That's also helpful. And then once you know what your posture is like, look at the postures that you're in during the day. So look at, if you're sitting at work for a long period of time, what are your ergonomics like? Are you sitting with good posture? Are you sitting with your keyboard and your monitor in a good position? We have other videos on ergonomics, and I welcome you to check those out. And make sure that your ergonomics or your sitting environment is encouraging good posture. And good posture, I don't mean that you have to be ramrod straight all the time, but the longer you're in a forward position, the more strain there is on the muscles and the more back and neck pain we usually will see with that. So that's number one. Watch your posture, make sure you're making adjustments for that posture, and make sure that you are aware of your posture. That's key. There's also a little device that will help you become more aware of that. It's called the Upright Go 2. We'll put a link for that in the description as well. And that can help remind you when you're not in a good postural position. So that's number one, watch your posture. I know it doesn't sound exciting, but it is one of the main things that can reduce back pain and neck pain in those with scoliosis and kyphosis. So number two, manually mobilizing that tissue and getting things to loosen up. So what I mean by that is using tools to massage out the tension, or having someone, a massage therapist or someone close to you, massage out that tension. A lot of times, a lot of the pain I see in scoliosis is on the convex side of the curves. So if we have a curve going this way, it's on this side of the curve. And it's because those muscles are tight and they're overworked. If we can get good blood flow into those tissues and help loosen up the tension, we usually see a reduction in the back pain. So I have a few products that are helpful to reduce tension in the muscles and reduce the pain associated with scoliosis and kyphosis. One of those, a simple one, is the Theracane. The Theracane is something that we use quite a bit in the clinic and have our patients use at home, but it's a simple hook that you can work on massaging those muscles in your neck and even massaging the muscles in your back by yourself, not needing anyone to help you. And it's simple, it doesn't cost very much. I'll put a link for this in the description as well. And it's a good way to loosen up those muscles. If you want to go a little more aggressive though, massage guns are really popular right now, and there are a lot of different kinds. This is a Hyper Ice massage gun, and it works really well. It is comfortable to use, and you can use it on your neck, you can use it on your back. It's quiet. There are a few different massage guns that we've promoted in the past on YouTube, and I'll put those links in the description as well. Massage guns are great. Most of my patients, probably over half of my patients, have a massage gun or can have access to one, and they can work on their backs with those. So that's a good option as well. There are other little vibrating massage balls and things like that that you can use to reduce the tension in those muscles too. Another option is to use a massage therapist. You can schedule an appointment with a massage therapist that can really work deep into those muscles and see if they can loosen up that tension as well. So that's number 2, working on the tightness of the muscles mechanically with massage, either with a device or with a person or something like that to loosen up that tension. That will give you pretty much immediate relief of some of that pain. It won't fix the problem, it doesn't fix the scoliosis, but it does help to manage the tension in those muscles. So that brings us to number 3. Number 3 is the one that's a little more long-term. Number 3 is doing scoliosis-specific exercise with someone specialized and trained in scoliosis-specific exercise. Now, I'm not saying you need to come see me in Lehigh, Utah, at Align Therapy to get treatment with scoliosis-specific exercise, but find someone around you or someone you have access to that can guide you in scoliosis-specific exercise. The key point with this is they need to know what they're doing. This isn't just regular physical therapy. This needs to be something where they're addressing the imbalances of the spine, the asymmetries of the spine, teaching you how to manage your posture and manage the curve so that you can have less back pain in the future. This is the long game. This is, okay, massage has reduced the pain, our posture is good so our pain isn't as bad, but how do we address the underlying problem, which is the scoliosis or kyphosis? And we do that with scoliosis-specific exercise. Something like the Schroth method, the C's approach, the Lion method, something like that that is specific to the curve. I can't emphasize that enough. It needs to be specific to your specific curve. And if you're working with someone that knows what they're doing, they should be able to guide you in that. So I would highly recommend doing that. Not that you have to come here, but find someone, even if you have to travel, invest time, money, things like that, it's worth it. If you have scoliosis and you have back pain and you've had this for a while, let's do something about the underlying problem. So that's number 3. So just a quick recap. Number 1 is working on posture and ergonomics so that your muscles aren't as stressed. Number 2, mechanically or manually working on the muscles and loosening up the tension. And number 3, focusing on scoliosis-specific exercise with someone trained in how to do it that you can learn how to address your specific curve. If you do those 3 things, you'll have a good result with your back pain. It doesn't have to be that you have back pain with scoliosis. You don't have to live with more back pain and neck pain and other aches and pains because of your scoliosis. There are things that can be done. I'm not saying it's going to fix the scoliosis, but you can manage it better, and that's how we live better. So thanks for watching, and hopefully you take something away that is helpful. Don't forget to subscribe to the channel. We'll do other tips like this, and thanks for watching.